Hey, good morning. This is Steve Stein, Chief Medical Officer at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this beautiful Tuesday morning. I have my mask on because I'm getting my shot on. Time for a little Moderna action coming my way, and I'm excited to get my second shot of the vaccine. We have a pretty special guest here this morning. Our good friend and colleague, KDHE Secretary Dr. Lee Norman is back. He's going to update us about vaccines across Kansas and where we're headed, what our plans are, and how he's going to personally be putting vaccine into the arms of every Kansan. How about that, Lee Norman? Gave you a little extra work to do.
Thank you very much. I appreciate the invitation again, Steve.
We're here for you. Hey, Dana, how are we doing this morning?
You know, I think we still can be happy. We can be optimistic how things are going. 38 acute active infections.
We are under 40 again.
We are under 40.
Yes.
Only 9 of those in the ICU and 5 of those on the vent. We still have 63 though who kind of remain here recovery. Yeah. So that's the majority of our patients right now. 7 of those still on the vent. So 101 patients in the hospital, which is a good thing.
You know, isn't that amazing? You just said there's 101 patients with COVID in the hospital. That's a good thing. That is by far and away our leading diagnosis. It's not even close, right? And we're calling it a good thing.
Yep, I know. It's better than 180 or up to 200.
I know, it is. We were right up there before, so we're like at almost, you know, we're a little more than half, but well, no, not of our acutes. Our acutes are less than half of our peak now because we had over 100 or 102, 105 acutes at one time and 38. That's a really great thing.
And then Hayes, 16, but 7 of those are active and 9 recovery. So they still have more in that recovery phase as well.
Okay,
so
that's pretty cool. All right, so I'm going to recommend I'm going to invite one of our directors of nursing here, to Janes, to come in and let's do this. I got a call to arms coming and I am ready to go. I promised that I would try and do this and be nice this morning to 2. That's, you know, we'll see how that goes.
You're taking your shot.
I know,
I'm not
giving it away my shot. You know, there's a song about that. You know where that's from?
I've heard.
You know where that's from, that song?
Hamilton?
Hamilton it is. Well done. Do not throw away your shot. All right. But, you know, I've also going to show it because my wife said, no, you can't try and look cool on the camera. You can't wear a wife beater or anything like that.
Oh, no.
61-year-old men should not be on a camera with a wife beater. How about that? How about that? I worked out this morning. I pumped some iron, made sure I got my lifts in. Got about 50 push-ups in, made sure I could look like I was buff.
We can talk about if there's boosters or anything else that we need. We can talk about then.
Yeah. Well, somebody actually recommended I get a muscle shirt with the little pads in it to look a little stronger. But I didn't think I should do that. So Hawkeye, what are you hearing from these second shots? I'm hearing pretty good news so far. People are doing okay.
Some people, you know, again, we know from the Moderna briefs that there was a higher percentage of people having any reaction at all. It went from about 80+% to about 90+%. And as far as the intensity of those symptoms, it just varies from person to person. Some can be a little bit worse. Some can be a little bit better. So.
Thank you, ma'am.
You're welcome.
So, too, now you and I.
Here's your card.
This is my card. Thank you.
You have your first dose lot number and your second dose. And this will become important to you later, possibly for travel. So please keep it safe.
I will have that in my wallet. And Tina, just to be, you asked me a couple of questions. What were some of the questions I had to answer this morning?
This morning, I'd ask you to make sure that you're feeling fine.
Yes,
and
I'm feeling good.
You're sick. And then if you had had any symptoms from the last one, and you had told me that nothing that Tylenol could take care of.
Nope.
So with your second dose, if you do have symptoms very similar to your first one, kind of cold flu-like some symptoms, if it persists more than 2 days, please call your primary physician.
Okay.
Let them know, but I don't anticipate you having any problems.
I sure hope not.
No.
I'm ready to go.
Okay, I'm going to be monitoring you for about 15 minutes, and I'll be back.
Thank you very much. All right, so Dr. Norman, how are things going throughout the state of Kansas right now?
Well, statewide, we're reflecting what Dr. Hawkinson talked about with very much improving numbers. Yesterday on Monday, following the Friday to Monday, 3 days, had about 1,900 cases statewide, which is 650-ish a day. And you'll recall that even a month or 2 earlier, we were having 2,000 to 3,000 cases added on a day. So statewide, the new cases are dropping in some situations rather dramatically. Hospitalizations are dropping. The number of deaths per day are dropping. Obviously, we're never satisfied until we get down to zero. So we still have a ways to go. I deal with hospitals regularly, as you know, and statewide hospitals have a lot of breathing room, and staff are coming back. Staff are immunized. There are very few out due to illness, and isolation and quarantine periods are done. So there's not a staff crunch around the state like we were seeing. And I know you guys felt that, but that was, whether it was urban or rural or remote sites, that's all getting better. So very, very upbeat in terms of the numbers.
You know, one thing I've thought about, Lee, that I think is really important, with these variants coming out, they look like they're so much more infectious. They spread pretty rapidly. Talk to us a little bit about where we are with that in Kansas, and maybe the importance if those variants take off and we have another surge of having vaccinated our healthcare employees. Right.
First off, we've increased the capacity in the state to do the genomic sequencing. We do it, and matter of fact, this week we're installing a second platform to double or more than double our throughput on the sequencing so we can see what strains of viruses are there. K-State Lab is also capable of doing this. So we're increasing our surveillance to find out the ones that we've talked about from the United Kingdom, South Africa, and now Brazil have not been found in Kansas yet. Now I have, and Dr. Hawkinson will probably comment on this as well, that these strains are around in our country. They will find their way to Kansas. We are investigating one outbreak in a correctional facility that is acting completely different than other ones we've seen. We have more than 250,000 cases in the state of Kansas, so we're getting pretty familiar with what these look like. And this one went from having 0 infected individuals or positive test results coming back to having many, many over just a couple-day period of time. So we're doing genomic sequencing on every one of those persons in this particular correctional facility. So and I work with my colleague, Dr. Randall Williams, on the Missouri side as well. And similarly, Missouri, with a significant amount of genomic sequencing, also has not found these variants yet. The vaccine will likely be protective, but not to the degree that is protective is yet to be known. And I think that it's still, of course, advisable for people to get the vaccine. The question also, and I'd be happy for you to ask Dr. Hawkinson this, is what are the implications then for continued mask wearing and social distancing and the like after we get all the shots in arms that we trying to catch up all the time, of course.
You bet, our call to arms. So Hawkeye, let's play into that for just a moment. I think once we get everybody vaccinated and the vaccines remain effective against the strains that are out there, do you see a day when we can stop wearing masks so much?
I do. I don't know when that will be. I don't think it's going to be any time maybe before the end of the summer or the fall. I don't think we know that because right now just such a small percentage of people have gotten even 1 dose of vaccine, much less 2, and are at that maximal protection. So I think there will be, and hopefully there will be, and we know Dr. Fauci has talked about that as well, but just when. And I think it's going to be, quite a few months still, but we definitely want to get back to that. But for the time being, even if you're vaccinated, even if you've had 1 dose or 2 doses, it's still going to be masking, distancing, not meeting in large groups.
Yeah, I think that's right. And I do think there's strong hope here. Once you've been vaccinated, it just feels a little safer to travel. It feels a little safer to get on an airplane. It feels a little safer to go out to the grocery store. It just feels a little safer. What do you guys think? Is that right? Is it just a little safer then?
I would absolutely say, yeah, it's a little bit safer.
Yeah, I think so. What do you think, Dr. Norman? Is it safer? Can we open things up a little more?
Well, I don't think there's any question that it's safer. I mean, the vaccines lead to antibody formation, and antibodies work to prevent infections and for those people that do get an infection, to mitigate it so that they don't have severe infection, hospitalization, and death. So I think that there will be a general trend towards opening things up a bit. I don't think there's a bright line on the ground that says, okay, we've reached that spot now. I'm getting a lot of questions from the legislature. The Kansas legislature is in session, and they're asking, what does this mean for the statewide emergency declaration, for example? And when can we back off and return more towards normal? And I don't think we're anywhere near that yet. I mean, with this trickle of vaccine coming into this state, there's such a huge demand for it that we're going to be, as Dana points out, deep into the summertime before we really can just exhale and say, oh gosh, we finally got through phases 1 through 4, and let's hopefully by then we'll be school age kids and whatnot that can be vaccinated with, but we're not there yet. So I don't think that we want to let our guard down.
So, Dr. Norman, what's your sense of when Kansas will get more vaccine? I know it looks good for the J&J and Novavax at least. Hopefully that's going to boost supply. AstraZeneca data ought to come out in March. And obviously the J&J data hasn't come out yet, but I don't think they would have put that press release out unless they thought it was going to look good. So what's your sense of when the vaccine supply is really going to start to ramp up?
To your point, Steve, it's when there's a new player, because I don't think what I'm hearing coming out of Operation Warp Speed, that the production capabilities are going to uptick. I know there's some tendency towards protectionism in Europe for vaccines that are produced in Europe to stay in Europe. So I don't think we can look to foreign markets for necessarily increasing our supply. So I think it'll be by having a new entrant, whether it's J&J, Novavax. I think AstraZeneca, if anything, seems to be getting a little bit pushed. We are in a rhythm now. That's the good news. The cadence that we have is pretty predictable, and the Biden administration is helping us by giving us always a 3-week lead time. See, we were driving everybody crazy at the county levels because we would talk to them on Friday and say, here's what you're going to get on Monday. And it's hard to know, do you gin up 100 people to get vaccinated, 1,000? And that's hard to do on short notice. So if we can get a 3-week lead time on letting everybody know, it just becomes a lot smoother for the administration. But to your point, we do not have enough, and that is, without question, the source of anxiety, and particularly for the older folks who there's a lot of hand-wringing going on, and all I can say is we don't keep any of it at the state. The feds push it to us, and we allocate it right out to the vaccinating sites. And but 45,500 doses a week ain't going to cut it.
No, it's not. It's going to take a long time to get everybody vaccinated, and by the time we get done, even getting anywhere close to vaccination, we're going to have to turn right around and start doing another shot in a year. So I think that'll happen. We'll have to do a booster in a year anyway. So, Dr. Norman, when the vaccine starts coming out more, right now you're working through the health departments. Yesterday we had KHA and MHA here, and Herb Kuhn of MHA was talking a little bit about there are 16 centers across the state where they were working with health departments, but also really a lot of health systems, et cetera, to form kind of these large regional hubs. Do you see anything like that coming? What's the role of health systems? What's the role of the health departments as you see the landscape going forward?
Yeah, that's a great question. And every state has done this differently. As you will well remember, the Trump administration didn't really provide any playbook for any kind of constancy across the states. So everybody worked within the fiber of their own states to determine the best way. Kansas, and to a degree Missouri, but especially Kansas, is very much a home rule state with local jurisdictions, meaning counties. So we made way back in October of 20, when we submitted our plan to the CDC, it was based on a county distribution, essentially. And, you know, it's been fascinating. The counties that had health departments, health systems, pharmacies, medical practices, safety net clinics and the like, those counties where those already work together are just hitting the ground running. They redistribute from the health department. The health department might say, we're not doing any vaccination clinics this week, and push it out entirely to a health system or to a community clinic system or whatever. Those communities and those counties are just humming. There's others, and I'll just be honest with you, that where there's kind of animosities or jealousies or longstanding differences of opinion or something between these various entities. And I'll tell you, that is showing up in terms of rough spots in terms of the distribution of the vaccine. Is it getting out there? Yes. Is it getting into people's arms? Yes. Do we have wastage that is of significance statewide? No. I know of one instance where there were some doses wasted because of I think a mistake made, quite honestly, that was unfortunate. But for the most part, the vaccine is getting pushed out and getting into arms. I don't think that we particularly need to have a regional approach. And the reason is we have so many vaccinating sites and in every county. You'll hear this afternoon, the governor's going to talk about a new Where's My Vaccine or Find My Vaccine site on our vaccine website that will be going live this week. It's got a lot of vaccination. That's a view of our www.kansasvaccine.gov. There will be a go live this afternoon on Find My Vaccine. It's a map of Kansas that'll have the active vaccinating sites. Now, most of the dots on the map won't be lit up because they don't have vaccine. So, I mean, just think about community pharmacies, for example. When we flip the switch with community pharmacies, if all of a sudden we went from 45,000 doses to 200,000 doses, which we could do, by the way, in the same week as we get it, those lights will pop and people will know then to go there. So on the one hand, people, I think, will look at a map with lots of dots on it and say, oh, great, there's a lot of places where vaccine will be given once we have sufficient vaccine. But then there'll be kind of that sinking feeling a little bit, which says, oh, well, there's not as many. Yeah, and there's going to be a lot more dots than that. But that's kind of the first whack at it. I think you'll see that there's plenty of places. It's just a matter of getting enough vaccine.
I tell you, we have this conversation a lot with our patients. It's like they're so mad about this or that. And I get emails from people who know me out in the public, can you please help me? And it's like, no, the problem is there's just not a vaccine. And quite honestly, we have to make sure that everybody has equal opportunity to get the vaccine. What we're seeing is that some folks who have higher means than other folks are more able to get registered or quicker to respond to my chart. I mean, there is a certain inherent discrepancy, and we have got to make sure we get this fairly distributed to all people, I think. So, Lee, Dr. Norman, you have that vaccine website. Let's talk one more minute about that, kansasvaccine.gov. That vaccine dashboard, how can the public best make use of that dashboard?
I think that people are real interested in knowing, it's that one that says learn more right in the middle there. People want to know where the vaccine is coming into the state and where it's going, and it's listed county by county. It tells the total number of doses that have come in, the total number have been administered, age group. And by the way, just stop there for a second. This is kind of fun. Well, it's kind of interesting, I should say. By age group, we had a lot of concern early on that how come the older folks were not getting the vaccine as much as the younger folks. And the reason was coming in, as you remember very well, phase one was included healthcare. And we have a lot of healthcare persons throughout the state, and they tend to be 25 to 55. So the number of people in the 65 and above was relatively small. But you can see that now with, 27%, that's just pretty much within the last 1 or 2 weeks. Now that we've finished phase one with healthcare workers, and about 75% of the long-term care residents are completed. About 50% of the staff are completed. We will have more long-term care folks that will be done within the next 1 week or two. Then the numbers will creep up, obviously, more toward the older population. Also on this same site, to your question, Steve, is county by county, what are the allocations? And one has to be careful because we don't like to break up lots of vaccine vials. The smallest number we can send is 100 doses. So you might see somebody that gets 100 doses, the smaller counties gets 100 doses this week, 0 next week, and then 100 or 200 the next week. This will make more sense as time goes on. Obviously, Johnson County, the most populous county in the state, and with the most healthcare people, I might add, is that many. Leavenworth, there's 7 counties that have gotten an absolutely proportionate share based on their population. Finney County, I don't know where that is in there, but they did a 1,500 shot clinic not too long ago, and they did it without any even breathing hard. So I think we have really good examples, shining stars around the state. Your own organization, KU Health System, is one of them that can do a terrific throughput. We just need more vaccine.
You're right. We're ready to do 10 to 15,000 patients a week here in the health system. So we could do, a third or more of the entire vaccine supply you're getting. Obviously, that's not right, but we just need a lot of vaccines to make sure we get it into a lot of arms. Well, let's see if there are reporter questions out there right now.
I do have one from the Shawnee Mission Post. Kaylee wanted to know if the correctional facility that you're talking about is Winfield Correctional Facility, because she said you talked about that last Tuesday. And she wants to know if you've done contact tracing. So do you know the source of the new infection spread?
Yes, we've done case investigations and then following on with contact tracing. And we knew that it came in through the community, through the food services workers. Beyond that, I don't know. I'm just not close enough to that detailed work. But yes, it's interesting, Jill, and in response to the question, only about 30% of the time do we absolutely epidemiologically link a particular case with its known source. And it's a little bit easier in correctional facilities because the offenders don't come in, for the most part, except from work release programs and the like, they don't come and go. So it can be a little bit easier there because usually it comes in from the community, which is exactly why we want and consider the offender population to be a group that needs to be vaccinated too, is because they're not only vulnerable, but they serve as a source of continuing spread in a community because people come and go a lot.
And did you want to confirm it's Winfield? I think what she's wanting to know is there more than one correctional facility, or are we still talking about only one?
Yeah, it's just that one. And the only reason I even felt comfortable talking about it, well, one, it's not privacy information. We post outbreaks on our website, but somebody in the press before I even talked about it had asked me about it. So I knew it was already out there in the general public. We try to keep private things private. This is one we would post on our website anyway. Of course, it's not an individual.
And,
all right.
And then Ashley just wanted me to tell you, Dr. Norman, that to clarify, the governor will talk more tomorrow at our news conference about Find My Vaccine, not today.
Oh, okay. Yeah, that's right. I got off by a day. Tomorrow
Yeah.
at 4 o'clock.
You know,
Yeah.
sometimes when you don't sleep, day becomes night, night becomes day, and yesterday is tomorrow. Just a thought.
That's not like Groundhog Day, Steve.
Is it? Well, yes, it is. And isn't that true today?
Are there any other reporter questions? Because I don't have any more. And 2, is it ready yet?
Yes.
All right, 2. I'm still upright. I'm still bipedal. I can still move. I haven't
right.
collapsed yet.
Great. I'm
my
glad
mask
to
on,
hear
though.
that. Stay here.
All right, I'm going to sign. This just says I've consented to have received the information. I'm
Yep.
good to go.
You're good to go.
All right. Thank you very much for coming down and spending part of your
My-
morning with me. I know you got a lot of places to be, and this is probably not the best place, but I'm glad you're
My
here.
pleasure.
Thank you.
My pleasure.
All right.
Thank you.
Thank you.
Now, I've been vaccinated twice in 2 more weeks. I still have to follow the rules of infection
Yes.
control. That's a good thing. Thank you, Tube. All right, Jill, let's see what questions we have out there.
Oh, gosh, we've got a lot.
Hey, Dr. Norman, what's your timeline today? Mine's a little bit of a hard stop around 8:35, 8:40 today. What's yours?
I'm good as long as you are, Steve.
All right, thank you, sir.
Okay, Karen wants to know, are the severity of the vaccine side effects directly related to the amount of immunity that a person will have?
Hawkeye, unfortunately, I'm not sure that's a good correlation.
Yeah, I don't think we really need, we know that. I don't believe it is. We certainly believe that if you do have a reaction, that it is because it's your immune system, but I don't think there's any necessarily correlate there with the amount of antibody you may ultimately get, the peak levels of that, or the amount of T-cell response. So I just don't think we have a good answer for that.
Hello from Barbara in St. Joe, and she wants to know, I've heard a lot of conversations where people are saying that if you had COVID, you are much sicker after your second shot than if you didn't have COVID. Is there any truth to that statement?
What do you think, Hawk?
I don't think we know that either. There's anecdotally, again, back to the first question, we know that people who don't really mount any site reactions or have any illness after the vaccine still mount good response and immunity. The same thing for this. I think it's individual. We just don't, I don't think there's any broad trend that if you've had COVID and you get vaccinated, you are going to have more symptoms.
So it's
some people
interesting.
may and some people won't.
You know, the Washington Post reported on a pre-release date. They didn't even say whether it was a small number of patients where they looked at the immune response
Yep.
to a person after who's had COVID-19, documented COVID-19. then they get their first vaccination, they have a much higher rise in antibody titer than those who hadn't had COVID-19 already, raising the question of whether or not someone who's had COVID-19 needs one shot or two.
Yeah.
It's too early to know the answer to that. But it is an interesting question. You only need one shot. And we have had some folks, I know one of my friends here who's had COVID-19 and then with the second shot got pretty sick. But on the other hand, we've also had people who haven't had COVID-19 get their second shot and get a little sicker than with the first one.
Yeah, and I've had friends, colleagues here who had COVID, got their second shot and did a lot better than they did with the first.
Yeah.
So I don't think we know. We don't know the antibody correlate either. That was a very good article. I think it's still preprint.
It's preprint, yeah.
But, it did say that you have higher antibody levels if you've had COVID and then you get the vaccine. I don't think that we can draw any conclusions from this. We don't know what level of antibody correlates with protection, and what above that, is that going to give you more protection or not? Remember, it's antibodies, but it's also T cell responses, another immune cell. So it's a good article. It is a preprint. But it certainly doesn't answer the question, and it's just more data, and hopefully the picture will become more clear as more people are vaccinated.
We're building the airplane while we fly it, and we're always smarter in 2 weeks than we were today.
But it's an interesting finding, and I don't know if it's because you've gotten infected with COVID, so you have some sort of immune response, especially to spike, then you're given only spike with Moderna or Pfizer, and so your antibody levels, those B cells that are already circulating, just get ramped up into overdrive.
Yeah, it's interesting how strong your response is to the spike protein after the vaccination. I don't know, Dr. Norman, any thoughts that you have about that?
Yeah, one thing to add is that we have a system for monitoring side effects and complications called the Vaccine Adverse Effect Reporting System. And our disease prevention immunization group follows that very closely. And we have seen, it agrees entirely with what you guys just said, which is, if COVID-19 infection had occurred, that we aren't seeing increased number of side effects from it, hasn't been any adverse effects. There'd be nothing coming out of the VAERS system that would suggest that COVID-19 previously infected people should approach it any different than Jockey Public that didn't have it.
All right, Jill.
Jeannie wants to know, and this is a question that her son had, since the Johnson & Johnson vaccine is not using the mRNA delivery system, is it like most vaccines where a live virus is injected?
Right, it's not a live virus, it's an adenovirus vaccine-based vector, but it's talks to us a little bit about that.
Non-replicating. So it's a non-replicating, so it's not quote-unquote live. It is a non-replicating viral vector. But it's similar in other aspects that, vaccinations, different vaccines have used other vectors like this, but it's not a live virus. Just, the most common live virus one that we use is measles, mumps, rubella, or the inhaled influenza virus as well, which are live replicating viruses. This, the adenovirus vector, is a non-replicating virus, so it's not going to replicate inside your body.
All right, Sarah doesn't have a question, but she wanted to give a shout out to Dr. Norman for all your hard work. She goes, I'm a nurse at elementary school in Lenexa, and I get my second Moderna vaccine today, just like Dr. Stites.
Awesome. And we should say thank you to Dr. Norman because I'm not sure he has a life.
No, there's no life to be had. Speaking of Groundhog Day, we've had 375 of them. It was 2 weeks ago we celebrated our first full year in incident command, which the battle rhythm in incident command is 24/7, 365, us along with the State Emergency Operations Center. And I had a matter of fact, I have a COVID-19 piñata that I was going to pull out and celebrate, but on that 365th day. And I chose not to because we still have people getting sick, we still have people hospitalized, and we still have people dying. And when I'm going to pull out the COVID-19 piñata is at a time when, to Dana's earlier points and yours, Steve, when do we get more towards normal? When can we start opening things up? When do we get enough shots in people's arms? But it has been an exhausting series that has gotten us here. And I'm just really thankful for guys like you and working with the media and others to get out the good word, because good information is so hard to find. And we rely on you to do that. Thank you.
Well, you're very kind, and I think Hawkeye's better at that than I am because he knows more than I do. But what I know is that it's clear it's clear that the rules of infection control, which include masking to all those who have all sorts of, I'm just going to say it, crazy reasons that you shouldn't have to mask. The reality is this: the rules of infection control keep you safe no matter where you go. And the proof of that happens every single day inside hospitals and health systems across our country and throughout the world, and right here in Kansas City, even into this moment at this hospital in our COVID unit, where our employees have been safe since the beginning of this infection, because our patients who have COVID are grouped together, and our employees who take care of them don't get COVID there. There's only one reason, Hawkeye. Masking, washing your hands, all those things, they do work.
And PIs, non-pharmaceutical interventions, for
Yeah.
sure. And that's why we have to continue them even after vaccination. But I can tell you, once we are able to use that piñata, I'd like to stuff it with a few things other than candy.
I would too. Would you like to just knock it out? That'd be kind of fun.
Yeah.
So, Lee, how much influenza are you seeing in the state?
You must be a clairvoyant. I just texted
Yes.
Jill and said I wanted to ask a question. The answer is none. I mean, we're seeing little dribbles and drabbles here and there, but there is essentially no influenza this year in
And
Kansas so far.
there's only one reason, right? It's not happenstance. It didn't just, it's because infection control works, right?
Right.
Infection control works.
Right. I think we can give some credit to the fact that the influenza vaccine uptake was quite good this year. People said that with all this going on with COVID-19, I don't need to add insult to injury. So I think there was good uptake of the vaccine, but there has been essentially no influenza. I bet you guys, Dana, I bet you haven't seen much influenza in the hospital at all. And when I say no, I don't mean zero, but it's essentially none. You know, influenza to the state is not a reportable disease, but we do get test results back. Oh, and I might add that we have changed in our lab to a multiplex test, which is when people send in for COVID-19 testing, we additionally get influenza A and influenza B on the same sample, even if it's not requested.
Yeah, we do
So,
or we can't do the same. Yep.
Yeah,
We're
and
just not saying, have we hospitalized a patient yet with influenza?
Not that
I
I'm
don't think so.
aware of. We do have, there was a lot of people who come to the hospital in influenza years that infectious disease doesn't see, but I know it's extremely low. And I know that looking from the CDC data, I think it was over 700,000 tests maybe, and there was a 0.1 or 0.2% positivity. In some of those labs, I would even argue maybe those are antigen tests, which we know can have false positive anyway. So, but it's an extremely low amount. Again, 0.1 to 0.2 in all of the tests that have been done since about September. So.
And right now, we should be at peak season, right? This should be it for us,
we're hitting
and
it,
it's
yep.
not. Jill?
I'm going to combine Carol and Janet's question. Carol wants to know what you think about President Biden's epidemiologist and advisor who was on Meet the Press that predicted the UK spread variant would be here in 6 to 14 weeks, what that impact would be. And Janet wants to know, the CEO of Moderna was on Good Morning America and said that it appears that the variant skirts the vaccine.
Mm-hmm. Lee?
I don't think anybody knows the entire answer to both. The UK variant is in the United States already. I'm hoping that between the vaccine being more widely used and its ability to prevent the spread of that UK variant, that'll buy us some time until we can do more fine-tuning of that vaccine. I think it does have a high likelihood of becoming one of the dominant strains in the United States. So I do worry about that. What was question 2, Jill?
It had to do with the Moderna CEO was on Good Morning America and was saying that it appears that the variant may skirt Moderna.
Yeah, I've not heard that.
So,
Right. Go ahead, Steve. Sorry.
No, I haven't heard. I was going to ask Hawkeye if he'd heard
It's
that.
the South African variant.
The South
to be-
African variant,
to
not
be
the British
specific.
variant, yeah.
So I think that there's some new information coming out. I saw something in the New York Times maybe today. So first of all, about the B117, which is the UK variant, and I know we continue to do that. We want to get away from that, but it's hard to remember all these numbers. And then the South African, I think, is B1351 or something like that. So from some, I think it was in Virological, the journal, there was some genomic studies done that actually looked and saw and identified the UK isolate or variant in the United States probably in November. There was some in California, and there was some in Florida. Essentially, it was about, and even through the beginning of January, so if we identified it first in November, or went back and traced the genomes back to November, even up through early January, they had only comprised about 0.5% of the total population in those two states. So it was a very small, even though it had been here for 2 months. There is some new data coming out that the UK has identified within their variant some mutations that arose, and that's the 484 mutation, which is present in the South African or the B135 variant. And that was the isolate or the variant that they looked to that maybe the vaccines were less effective against.
I read that.
So if that 484 mutation or amino acid substitution has occurred, and I think they saw it in a couple of different places in the UK, then certainly that could owe to that decreased efficacy of the Moderna vaccine.
And what I think it went on to talk about was that it is unclear if it's really a variant of a variant.
Yeah.
If that particular mutation is going to sustain or not, or it's going to be part of the more rapidly spreading one. It's not clear what it does to spread and other things. So when a mutation arises, it takes a while to figure out all the effects. So there is potential that this variant may affect the success of the Moderna vaccine as it is currently built.
Yeah.
However, the good news about Moderna and Pfizer is they can change their vaccine in 6 weeks.
Yeah.
Lee, one of the controversies was, do they need to then go back to the FDA, or can they just go ahead and make those changes like we do with influenza? I'm in favor of the latter, but I don't know what you would think.
Yeah, I don't know, Steve. That's a little bit out of my wheelhouse, the regulatory agencies that make that decision. I think Dana would be probably better equipped to answer that.
I would agree with you. I mean, they're not changing the delivery device. It's still that nanoparticle. So I would hope and think that they would be able to do just as we do with influenza vaccine, which are actually taking different strains every year, not just altering this mRNA as Moderna and Pfizer would do with their mRNA-based vaccines.
All right, one more question, Joe.
Okay, we'll do one more, but we have so many more. I want everybody to know that Dr. Norman has committed to one more Tuesday, and if we can talk him into it, we'll keep this going for a while. But Suzanne wants to know, how do you find out if your underlying health condition qualifies you for an earlier phase? Do you have to have documentation?
Great question. Dr. Norman.
You know, the answer to the question about are you included in which phase is on our website. It always will say what phase we're in, 2. We'll be here for a long time, by the way. It's the largest phase. But the phases are also defined in terms of which conditions fit into each one. But to your question, you know, there's probably 14,000 different diagnoses, and we don't list 14,000 different diagnoses and conditions. So the question really is what is my condition like? If it is enough like this one over here that is considered that, or working with my physician, is it one that that would be putting me at higher risk? We pretty much rely on your honesty and sense of community spirit to take it when it's your turn, but also working with your healthcare provider, with your physician, to understand the risk of it. And then if it means bringing a note from your physician that says, I feel that COPD is similar enough to, or that pulmonary fibrosis is similar enough to COPD that I should be considered in this particular phase, then I think that's fine. We just want it to be well thought out and honest.
All right. I want to say a special thank you to Lee and, of course, to Hawk. Tomorrow, Johnson County Director of Health and Environment, Dr. Sammy Areola, and Shawnee County Health Department Infectious Disease Division Manager, Derek Flurlog, joins to help update vaccinations in the counties on the Kansas side. Guys, final thoughts? Lee?
Well, first off, you've got 2 all-stars showing up tomorrow. I know them both very well. I work with them all the time, and you'll get the straight scoop from them. So good choice. And then secondly, all I'm saying is, people, I think we're going to come into a period of time where we're thinking they're going to look better. Kansas is healing itself. And I think that is because of your incorporation of these anti-contagion measures into your routines. And keep getting vaccinated and keep doing what you're doing. Kansas is getting better.
Hawk.
Yeah, just to follow up to yesterday, there was a question about Chinese companies and wanting DNA and offering services. I think, this just goes down to really the federal government, the state governments, and any entities which, may or may not be doing business with companies that it's not too obvious. We always know that there are countries or different companies that are in competition with each other. Certainly, we understand that on a global stage, the United States is in competition with a lot of countries. So I think, luckily we have our journalists and vigilant people at the business level and the government level to watch for that and monitor that, and hopefully we'll keep going forward in that way with vigilance and just trying to keep everything above board and do the right thing. So apparently it does happen. There were those mainstream media articles about that, but nothing to do, I think, on the individual level. It's kind of left above to companies, local companies and governments to help try and protect us and protect that from happening.
Speaking of the world at large.
Yeah, and I just want to be crystal clear. We are not giving anyone's DNA through our testing, and we will be doing interviews today on that subject. I think KCTV5 has been following it. So if you're interested in that subject, our vice president and our director of microbiology is going to be speaking to that.
So as we look across the world, we know that we have to heal the world. The other good news we didn't talk about was the Russian Sputnik V vaccine actually had 91.9% effectiveness in independent trials. So I think that's good news as well. The more the barrier, the more the merrier. Hey, as you've probably heard, 18 of our health system employees are among those going to the Super Bowl this year, courtesy of the NFL and the Chiefs. That means a lot to labor and delivery nurse Lauren Timmons. She lost her grandmother last year right before the Chiefs went to the Super Bowl. Her grandma, Lita, was a mega Chiefs fan. Right there with you, Lita. When Lauren saw that the Super Bowl numeral numbers were LV this year, 55, she knew it was meant to be. When her grandma, Lita Volgamot, passed, she had this gold LV bracelet made of her grandmother's initials. Now she is taking Grandma Lita in spirit along to Tampa to watch the Chiefs vanquish the Bucs and Tom Brady and get another Super Bowl win. As we close, I want to invite you to send us the photos of a short video of why you are answering the call to arms and decided to get the vaccine. Tell us your first name, your city, and your why. Here are some folks who recently answered the call to arms during the patient vaccination clinic. Enjoy. We'll be back with you tomorrow. Remember, the rules of infection control, where do they go? They go with you. We'll see you tomorrow.
Hi, I'm Beth from Gladstone, and I got my COVID vaccine today because I want to go see my son in Houston.
Hello there, my name is George. I'm from Shawnee, Kansas. I got my shot today because I want to be free, normal, and visit with my family again.
Hi, my name is Donna. I live in Prairie Village. I got the shot for my family, for myself, for everybody.
This is incredibly important. This is how we win the game. This is how we win a pandemic. Take your call to arms, don't throw away your shot, and begin to help us beat coronavirus.